Greetings, everyone. My name is Marius Ngouonom. I'm a PhD fellow at the University of Zimbabwe. I'll be working on the impact of prolonged gastrointestinal pathogen in children living with HIV on post-discharge mortality. We'll talk of gastrointestinal pathogen. These are the microbes that colonize our intestine and later on cause infection. We have to know that almost all children infected with HIV are carrying this pathogen in their intestine. This infection will greatly affect the life of those children. In some, it will lead to immunosuppression. We'll talk of immunosuppression. These children will not be able to properly fight other diseases. In some, it will also lead to malnutrition, meaning that they will not be able to properly absorb nutrients at the level of the intestine. And finally, it may lead to discrimination because those children having persistent infection, gastrointestinal pathogen, is excluded from activity of the family. This project, which is part of another big project called Support1, it's a great project because it will allow the detection of those gastrointestinal pathogens in a non-invasive samples too. We'll talk about non-invasive samples, a sample that can easily get from patients without difficulties. Here we'll use a technique called PCR, polymerase reaction, that will allow the detection of the genetic material, DNA or RNA, of the different microorganisms or the different gastrointestinal pathogens that we're trying to detect here. It's a cost-effective, easy and rapid technique compared to other techniques that we're currently using in our settings, such as microscopy, culture, and endoscopy. Both children and the community will benefit from this project. Children will see an early detection of a gastrointestinal pathogen and therefore an early management. Those that were positive also be followed up after leaving the hospital. You see, they're having persistent infection with this pathogen, therefore having a better management. This project is even important at the international level because data gotten from the mortality and morbidity rate will help in cutting up the attention of stakeholders and international organizations on the necessity to put more effort, more funding, and more researchers on this important and critical health problem.